Hey Siri,
Yes?
find me a reliable and dedicated employee.
Here's a reliable and dedicated employee. Ta-da.
Wish it was that easy? It can be. Welcome to VMeDx Podcast, your virtual assistant made easy at VMeDx.com. And here's your host, the founder and CEO of VMeDx, the Vladster.
Hey, what's up, everyone? Vlad's here. So, quick question. Have you ever felt buried in charting after a long shift? Like, oh, seriously? If you're a med student, nurse, or just someone working in healthcare, you probably know that paperwork fatigue is real and it adds up fast. Today, we're diving into something super practical, part-time virtual medical scribe jobs. This stuff is actually kind of a game changer, not going to lie. All right, so let's break it down. Why would anyone want to be a virtual scribe and why part-time? Picture this, you're in med school or maybe pulling long shifts and still want that valuable clinical experience without completely burning out. Virtual scribing gives you a way to work flexible hours from home in your sweats with real exposure to patient care without being physically in the clinic. So what exactly do you do as a virtual scribe? Basically, you're listening in on live patient visits, usually telehealth or sometimes in person via audio, and you're documenting the entire encounter in real time. That means patient history, symptoms, physical exam details, treatment plans. You're putting it all into the EHR while the doctor focuses on the patient. It's like being in the room, but without scrubs or stethoscope. Some gigs also include light admin tasks like pulling up lab results or past notes. But mostly you're there to make sure documentation is spot on. Now let's talk about what you need to actually do this kind of work. First, typing speed. You've got to be able to keep up with fast talking providers and chart in real time. So yeah, you should be comfy on the keyboard. Second, medical knowledge helps. If you know basic terminology, that's a win. But even if you don't, a lot of companies like VMeDx offer training. Third, attention to detail is huge. You're dealing with sensitive patient info. No sloppy notes allowed. And finally, tech. You'll need a stable internet connection, probably a secure setup, and the ability to use whatever EMR or charting software the provider uses. Now, why do this? First, flexibility. You pick the shifts that fit your schedule, nights, weekends, whatever works. Second, real-world exposure. You're literally watching how doctors think, diagnose, and document. That's gold, especially if you're pre-med or planning to apply to PA or nursing school. Third, income. You get paid to work from home while building clinical experience. And the best part, you're helping. A lot of providers are drowning in documentation. You're lightening that load, and that's huge. Here's a quick story. Sarah, a pre-med student, works 2 evening shifts a week as a virtual scribe. She learns from real consults, builds up her clinical vocab, and earns enough to pay for MCAT prep. No commute, no burnout. That's a win. If this sounds like something you'd be into, companies like VMeDx make it super simple. They train you, set you up, and offer flexible part-time roles. So here's your move. Update that resume, highlight your typing speed, tech skills, any clinical exposure, and apply. All right, that's it for me today. If you're looking for a way to stay close to patient care, earn some income, and not lose your mind in the process, this could be it. Go check out VMeDx, give it a shot, and let me know how it goes. Catch you next time, and hey, stay curious and keep showing up for yourself and your patients. Peace. Bye.
Welcome to the future of healthcare staffing. Do more and be more with VMeDx. Visit us at www.vmedx.com.